Good morning, students. Today we will see about rehabilitation. The rehabilitation is what? Rehabilitation is what is the definition? When we have to start the rehabilitation, you will be surprised if I tell. See, the rehabilitation, the current scenario is telling that the rehabilitation should be started initially when the patient is coming for the first time to the hospital for any treatment, X or Y. Even a diabetes you have to take, but you have to tell in a positive way. There was one my friend called from America. They told all negative way. One time she went to as a 26-year due to stress-related diabetes mellitus because she gave birth to two child alone in the America. No relatives were there. That depression made her to get a diabetes mellitus. After 2-3 visits, they told, slowly you will get hypertension. Slowly this will become a big complication. That is not the approach. Understand? That is not a rehabilitation approach. That's a negative approach. That's you are demotivating the patients. No, that is not the way. You have to tell in a positive way. So there is a people living with diabetes. If there's a two kind of problem in diabetes. Sudden cardiac arrest because no pain you will feel it. So maybe go for amputation. So your sugar level is controlled. You can prevent all these things. That is the rehabilitation. It is not the way you are hypertensive, okay, you are going to die soon with a cerebrovascular accident. No. Rather than that, you do exercise, medications, avoid this dietary management, medical management, stress-free and good sleep will make you to live long. You can prevent CVA. That is the rehabilitation. Understand? Okay. Let us go to the topic. What is the definition? Rehabilitation is a medical, it's not a one measure. It is a medical, social, vocational, psychological measure, train and retrain the individual and helping him to attain or restore the maximum potential of his life. Ability to live. Understand? Okay. Why it is called medical measure? Why it is called social measure? See, in all aspects, the main role of a nurse, we have to integrate with all other departments and give them the good rehabilitative way. What is the goal of rehabilitation? To restore the patient's ability to function independently. Are you understanding? So independently they can live. For example, even a blind, some people will be retinal detachment. They will tell, first year you are entering, within the fourth year your retina will be totally detached. You now itself start practice with braille and use these devices to lead your normal life. What is the objectives? To prevent the further disability or handicap, to prevent the person's from protect the person's ability, to restore the affected person's ability to possible level of functioning, to assist the person or to use his own ability with their maximum potential level. Are you understanding? What is the principles of rehabilitation? As I told you in the beginning, it should begin in the initial contact with the patients and restore the patient's independency, respect, and active participation is an important principles of rehabilitation. Motivation is an essential principles of rehabilitation. Integration is a very important principle for the nurses has to follow. Integrate with all the other departments. She cannot do zoo boomba. The person will be all right. You have to coordinate and link, and you must be a liaison officer. Provide at a right time is an important, innovative and ambitious care and easy to access to everyone rehabilitation and realistic principle and meaningful, and it should be flexible. Are you understanding? What is the type of rehabilitation? According to the type, you can see medical rehabilitation. What is medical rehabilitation? What we are going to do? Corrections of deformities, counseling services, then physical therapy, speech therapy, occupational therapy. Some things you will be giving in the medical orient. Social rehabilitation to restore the social relationship and also give the vocational training and recreational activities and solving the community problems. Vocational rehabilitation help those who try to difficult to get their employment. So you can give some vocational training, for example, candle making and paper plate making, or some flower making, painting, something you can make them. Economic also same like a vocational. What is called cardiopulmonary rehab? It's a medical treatment related rehabilitation, like how you improve your cardiopulmonary function, that rehabilitation. Physical rehabilitation helps to walk, help to use the prosthesis, speech rehabilitation, and occupational rehabilitation. Okay, what is the role of the nurse? Okay, what are all the team members are there? What is the skill is needed for that? What is the elements? What is the elements of rehabilitation? There are four elements, mainly the preventive element, restorative, palliative, and supportive element. Are you understanding? Then what is the skill? The excellent listening skill is very important for rehabilitation. Half they you listen their problem, they feel relaxed. They will really cooperate, they will participate. Once they are participating, you will succeed. Problem solving skill, communication skill, positive approach attitude. This is a very important skill. That's what I told you in beginning. Who are all the people there in the rehabilitation team? If you see rehabilitation team, there are many people are there. What all the peoples are there? Like occupational therapists, social therapists, and clinical psychologists. Okay, therapies, ergonomic. What is ergonomic? Fixing the people. This people using these processes, they will be good for this job. So that ergonomics, you can ask the suggestions. Physiotherapists, physicians, sports therapies, language therapy, speech therapy, all these people are there. What is your role? You will be integrating. So what is your role? Your role will be liaison officer, you will be teacher, you will be counselor, you will be advocate, you will do the research and case management. So these are all your role. So what is in the role? How each rehabilitation will be in a different one. So the role of a nurse, you have to first, each patients you have to prepare the goal. It's unique. Rehabilitation will be unique for one patient to another patient to provide the assistance in a diverse need. Different needs will be there. So what will be the objective? To achieve the optimal function of the self related care. They can do it. Promote the physical social well-being of the individual. This is your goals and objective of nursing. So you keep in that mind, and accordingly you formulate the plan of action and you implement the plan of action. You evaluate the results and modify it. Are you understanding? And train the faculties who are needed functionally, prepare how to make a care plan in a unique way for the rehabilitation patient. Are you understanding? So if this question coming, you can write all these things. What is the definition? What is the principle? What is the goal? What is the types and everything? Comparatively, you can write one model also. Okay. This is the model. The rehabilitation practitioner, how you have to do? You have to make the empowerment. What is the meaning of empowerment? Empowerment is the empowering the individual to bring out their own aims and objective, to help themselves to maximum level of ability to overcome all the problems is called the empowerment. Okay, so rehabilitation will empowerment will be doing, and this will be improve their self efficacy, so they can do independently depending upon themselves. So this continuously you are doing as this equal to lead to the maximum participation of the individual. There is a good progression will be there. This continuum is explaining what is the role of rehabilitation and then what they are doing it with this efficacy. So why this model and all? If you draw the model, when the other people are not drawing, you will gain more mark. Understand? So you can write what is the definition of rehabilitation, all these things in a simple form. For even a 10 mark, you can write 5 mark, you can simplify and write. Thank you.